Hi, and thank you for joining us. This is the Pacific Harbors Council Risk Management Fireside Chat with Roger Neal, the chairman of the Risk Management Committee for the board, and Karen Meier, who is our Scout Executive and CEO for the Pacific Harbors Council Boy Scouts of America. Also joining us remotely is John Pennington. John is the former Region 10 FEMA Director. He dealt with the Oso, Washington disaster, and he is currently running the bachelor's program for Homeland Security and Emergency Management at Pierce College locally here in Washington. Roger.
Welcome everyone, and first of all, on behalf of myself as a board member, I appreciate everything that each of you do for our units and our scouting family. You are the most important people in scouting. Our purpose today is to share with you some resources that we've developed in the council and the direction that we'll be going in the future to help you restart scouting in a safe manner.
Karen, can you talk a little bit about the general impact that COVID-19 has had on scouting, you know, in a basic sense, and how we're sort of having to be put in a position now where we've got to make these adaptations?
Sure, Warren. The impact on scouting, especially in Pacific Harbors Council, has been great. But what I love about it is that the innovation from the youth has come out more now than ever before. But also, it has taken the council back a few steps to really examine our risk management and our crisis communication plan. So at the end of the day, we're able to clearly and concisely communicate exactly the position of the council and our expectations for unit leadership to be compliant with our goals to keep the youth safe.
All right, thank you. You know, I could say there are a lot of different lessons that can be learned from previous incidences, previous disasters, or previous pandemics. John, the next question is for you. Can you talk a little bit about some of the lessons that, as a whole, our nation, in a risk management sense, may have learned from previous pandemics that we might be able to apply to the current one?
Yeah, absolutely. The short answer is not a lot. Remarkably enough, if we go back in time, 2009 was H1N1, and then 2015 was Ebola. And there were technically pandemic type plans that were implemented or at least drafted for both of those. 2009 really woke us up. 2015 scared us. But the reality is that this pandemic, and particularly the way that it evolved and how quickly it evolved, none of the plans were very much utilized. 2009 with H1N1 was really about mass vaccination. We began the process, if you recall correctly, if you can recall back in 2009, H1N1, we had a vaccination inoculation program, and it was designed around protecting first and foremost pregnant women and young children. So the plans that did unfold were truly revolving around how do we prioritize who gets essentially inoculated first. 2015 was Ebola, and Ebola was so scary that a lot of the local and state plans, many of which aren't really even talked about, focused on heavy quarantine of individuals so seriously that quarantine type facilities were actually put in place in communities in kind of a hidden way. So the long story short is there wasn't a lot that existed. Even with a lot of hospitals, they had talked about Ebola, but they didn't really plan for pandemics like the one that we're dealing with right now. So I think the way to succinctly summarize this is that there have not been a lot of lessons learned. I think if there was one that came out of 2009, it would be this. In 2009, when we looked at that vaccination inoculation type process, in Washington State, only medical providers, including nurses, are allowed to give those vaccines, in short. So once you have a proclamation of a state disaster in Washington State, it opens up a lot of flexibility, as we've actually seen during this pandemic. One of the options we had in 2009 were to engage EMTs or firefighters, paramedics in short, to give those inoculations right into the arm. Under normal circumstances, they can't, but because we didn't have enough providers, the proclamation or declaration of an emergency allowed us to do that. So as we lean forward in this pandemic, like a true serious worldwide pandemic, that's one of the options that's on the table for us right now is how do we look at alternative individuals who can give those vaccinations if we have mass hysteria, for lack of a better way to put it. So that's to me the primary lesson.
Thank you, John. I guess my next question would be for you, Karen. I know that we're going to kind of get into the nitty-gritty here a little bit. We have this COVID-19 checklist that has been put in place for activities and meetings. Could you kind of briefly talk about its purpose?
The purpose is to clearly and concisely weekly communicate to our unit leadership so they have the toolkit in front of them and up to date on a weekly basis of what the expectations of the council is and to help them with their own activity and camping decision tree. So we are providing the resources and tools for them to make an educated decision on keeping the youth scouts safe as well as the leadership.
Okay, thank you. The next question ties right into that. When, Roger, is it going to be safe to send our youth on scouting activities?
The $64,000 question, when is it going to be safe? And first of all, we know that safe does not equal risk-free. So there are certainly activities that units can do currently that the state, the medical community, the public health community, and scouting feels are safe. Small activities, a hike, outside events such as that, a patrol meeting. We're seeing a lot of scouting happening virtually, which is wonderful. There are other areas that people want to do scouting currently that are not recommended by the health professionals. And so this is going to be an evolving situation. The good news is, as we sit here in late August, statewide, the number of cases of COVID is going down. The bad news is we're a long way from any county reopening or going to the next phase. So, and we've got Labor Day weekend coming up. We've got some schools that are coming back into session. There's all sorts of guesses what might happen. So I really can't give you a definitive answer for when it's going to be safe. But certainly following the guidelines from the council, the national office, the Center for Disease Control, NIH, our public health officials, there are a number of safe, again, not risk-free, but safe activities that units can do right now.
So essentially what you're saying is that if scouters want to know and parents want to know, they can get a hold of our guidelines and they can review those guidelines, they can communicate with the leadership for the different units and make that decision, right?
Right. I'd recommend a couple things. First of all, on the scouting safety website, scouting.org/coronavirus is a safe scouting checklist, restarting scouting. This is from our national office. Now the challenge is they're trying to write a document that applies across the entire United States and not necessarily specifically for Washington. So that would be your first place to look. Then we recommend that you go to the website and look at the COVID-19 updates that we're doing on a weekly basis. Part of the challenge is that most of the guidelines that are coming out from the state are not written specifically for scouting. So we have to interpret what the intent is. And right now in scouting, as an example, our office staffs are working under one set of guidelines. The stores are operating under a second set of guidelines. A unit that wants to go on a hike, which would be considered an outdoor recreation activity, that's a third set of guidelines. Camping is a completely different set of guidelines. So there are at least 5 different sets of guidelines that impact what might happen in scouting, depending on what you're doing. And nowhere is there one that says just, this is what we do for scouting. And quite honestly, sometimes there's conflict between even the guidelines that we're getting. So Our recommendation again for a unit that's considering an activity, first of all, go to the restarting scouting checklist from the national office. It's on the website. Then check locally what we're doing here in our Pacific Harbors Council. And hopefully those two are great resources. The third that a unit can do if they're completely baffled or stumped or have more questions, they can reach out to Warren, send him an email, and he'll get that information to the individuals who will evaluate it and get back to the unit. We'll also share that information and those questions with all the other units in the Pacific Harbors Council. Because our guess is, if your unit has a question, somebody else has that same question, and we want to share that information with all of our units.
That's a great point, Roger. Thank you.
And that information can be found on the Pacific Harbors website as well. Right at the top, there's a, is it a blue box? What it is?
Dark
There's
blue.
COVID-19 updates. So you can click right there and then you can access that document. So I guess leading into some of the questions that we've got from Scouters.
Okay.
You know, I think it really is important to make sure that we address those concerns. I got a number of questions from some of the Scouters out there. They sent me emails and I've gone ahead and consolidated those questions into 5 basic questions, and hopefully I've covered them. If not, and there's still concerns, again, you can always email me and I can direct that to Roger and we can get clarification for it. The first question would be, how do we handle transportation? And an example would be, let's say there's a small group hike. We've got scouts that need to be transported by their parents, and they keep within the distance guidelines. How do they do it as a troop? I mean, did each individual troop have to follow the same exact transportation process? Do the parents have to take the scouts? Can they travel together? Can you talk about that?
Okay. A number of questions about transportation. First of all, it partly depends on which county you're in and what phase the county is in. So if you're in King, Pierce, or Jefferson counties in our council, those are phase 2 counties. The recommendations from the health officials right now is that you do not travel for non-essential travel. And it appears to us that scouting is considered a non-essential function. So that's the first question, is what county are you in and what. We've also taken the position for quite a period of time that you should not travel from a phase 2 county to a phase 3 county to do an activity. Now, specifically on transportation, scouting doesn't have a lot of good guidelines. The state of Washington doesn't have a lot of good guidelines. So I went to the Centers for Disease Control, another one of our resources. And they basically say, practice good hand hygiene, washing your hands before you get in the car, avoiding touching cover your cough, the standard stuff. Social distancing. Well, how do you social distance in a car? Pretty tough to do. One of the recommendations is, let's say you have a car that the back seat holds 3 people. Only put 2 people in the back seat. Secondly, because that's an enclosed space, and again, this is right from the CDC, since that is an enclosed space, masks should be worn at all times that all occupants are in the vehicle. Now, if we say all times when they're in the vehicle, that means that really you shouldn't be drinking water or eating while you're in the vehicle, because you have to. I'll take my visual aid here. You have to then take your mask off, and you've opened up your mouth and your nose, and you're spreading germs or inhaling. So we're recommending, again, this is beyond what the CDC has, but my recommendation would be, don't drink and eat in the car.
Okay.
Right? And then, of course, the same thing as with all activities, staying home if you're sick ahead of time. And lastly, then the CDC also makes 2 recommendations. One is, after you completed the trip, maybe you get to the trailhead and the unit's ready to go on a hike, disinfect those highly touched surfaces, disinfect the door handles, disinfect the window buttons, all those types of things. And probably one of the most important things is, and again from the CDC, is keeping the windows down or your air conditioner on outside air, so you're circulating lots of fresh air into the vehicle.
Okay.
Think of the vehicle as an enclosed space. And so those will be our recommendations on travel. It's not required that units or folks traveling together stay as a family unit or a household unit. They can mix those. Again, following the precautions. but I see people routinely, groups of people, they'll be outside wearing their masks, they'll get in the car, and they'll take their mask off. The place they really need to be wearing them is inside the car, that enclosed space.
Next question. When the guidelines are being followed, are the individual units going to need to take temperature checks?
At this point in time, yes, we are recommending temperature checks, and it is very important for a couple reasons. First of all, it gives you a chance to review the health history of every participant. This morning when I was volunteering at the food bank, my temperature was taken, my health care questionnaire was asked. It's really important, and we recommend that units keep those logs of who was on the event and what their temperature was for 30 days. Now, there's indications that temperature checks may not be a foolproof indication that someone is infected, but it is a great strategy, and the recommendations have been for a long time that if an individual has a temperature of 100.4 degrees or higher, they do not participate in the activity. So that again is that chance for the unit to check those scouts. Karen talked earlier about our goal is the safety of our scouts, our leaders, and this is how one way we can help keep them safe.
Thank you. Next question is in relation to camping. Are there any changes to, I would say, maybe the occupancy of a tent to our current policy that we might need to modify because of the pandemic?
No, we're following the Guide to Safe Scouting, and one of the questions that we've received is that an individual was under the impression that a single scout could not stay in a tent by themselves. That's not in the Guide to Safe Scouting. And so, and in fact, I checked this morning to verify that, and I've got it right here. It is not in the Guide to Safe Scouting. So you could have more than one occupant in a tent. What the American Camping Association is recommending, and it was going to be our procedures if we had run resident camps this summer, is that you put your occupants head to toe. So as an example, one camper sleeps with their head to the north.
Oh, I feel sorry for the person that has to smell some stinky feet.
Stinky feet or downhill head, yep.
I think that would be both of them.
And number two camper sleeps head to the south. Again, it's trying to build as much social distancing space within that confined tent as you can. If it's a three-person tent and you can have two in the tent, even better. So,
I think it boils down to just simple problem solving. That you assess the situation and you ensure that you forge forward mapping out your decision to be safe at all times by reading all the resources that are available to you at any given activity or camping outing.
So the last question that I wanted to cover for those that I received from Scouters involves Scouts with Disabilities. If there are any Scouts that may have immune-compromised situations, or maybe even their parents, what do you advise for those Scouters on how to participate or not to participate?
well, I'm going to defer to Karen, but I have my answer on this.
Oh, go ahead,
Okay.
and then I'll follow.
All right. My answer is you would approach this the same as you do any time with a Scout with disabilities. If the unit can make reasonable accommodations, great. We should be including Scouts with disabilities, but ultimately, especially in an immune situation or compromised immune symptoms, that's a parent's decision. So, Karen?
I think you answered that perfectly, Roger, because it is ultimately up to the parents who know their child's limitations and especially their strengths, what they can and cannot do in any given scouting outing.
John, if you don't mind, I do have a couple of questions I'd like to ask of you. One would be if you could just sort of briefly cover the role of the state and county emergency management in relation to how they interact with other agencies and organizations.
Well, it's in general, you have to step back and first ask the question, who is in charge. And in this case, I have to step really far back and say that there are three national disaster type policies that are in play right now. The National Emergencies Act, which gives the president really broad authorities, which you're already seeing. The Robert T. Stafford Act, which is the Federal Emergency Management Agency, or FEMA, and that drives down to the local level. And then you have the Public Health Services Act, and that covers all of the public health related things that trickle themselves down to public health. In general, this pandemic unfolded like most would or should, which is where public health officials generally are in charge and lead. That kind of tipped over a little bit once we started seeing that the larger economy was in jeopardy. And at that point, FEMA's umbrella kind of took control and overarched, and all the other entities come underneath it. They still have their authorities. So then to the fundamental question of what a state and county, and I'm also going to throw in locals, as in cities, but also tribes. So the role of state emergency management in this case has been truly to coordinate the massive influx of personal protective equipment, or PPE. The state did I think a fairly marginal job up front, really until a lot of the National Guard folks got in and started helping them with logistics. The counties, so if we take King, Pierce, Snohomish, and a lot of the smaller counties, the harsh reality is that we ran out of personal protective equipment very, very fast. And what we learned about the supply chain and logistics in our state and around the nation is that in as much as you could swipe your credit card very fast and technically purchase a lot of equipment, the reality is that even state and local emergency management offices couldn't find that PPE masks and gowns, isolation gowns, and things that would protect us as we went through. So right now, the role of state emergency management is to coordinate for the large part, the logistics, and then start the process of recovering dollars from FEMA. At the local level, what we're seeing is that emergency management, King County in particular, Snohomish County as well, is taking a larger coordination role when it comes to quarantining. Kind of the harsh reality is that public health and medical providers are really good at providing medicine and healthcare. That's what they do. They're trained to do that. When you ask them to get into running large facilities or small facilities that deal with quarantining and separating populations, they're not very good at that. They've trained very good, but it's hard to juggle multiple balls in the air at the same time. It's not saying that they're not admirable efforts, but in 2009 with H1N1, we learned very fast that health districts are great at providing health, but when you try to do that in concert with actually coordinating the response to or the recovery from a disaster, it's just very challenging. So emergency management's role now at the state and local level really is to pick up the pieces and coordinate everything when it comes to the larger response that public health and medical providers can't do. Tribes are a little bit different, and I bring tribes into this equation because scouts in particular will tend to take scouting activities that sometimes border scouting, or that sometimes border tribal reservations or tribally owned land here in Washington state. So understanding that their roles are a little bit different, whereas the counties are reporting directly to the state and working in that relationship, the tribal health clinics and the tribal health officers, which they do have, pretty much are running the show. There's not a lot of emergency management in many of the tribes in Washington state. So their public health entities, their tribal health entities work directly with the federal government. So the county-state relationship is here, but the tribe-federal government relationship is here. So if you're wandering or straying or conducting activities outside on tribal lands, I just want to point out that the relationship and the ownership of those, of the coordination response is a little bit different. So I hope that answers the question, but I think what I would want to leave you with three things that this is, when we say that we're in unprecedented times, I think that we need to step back and realize that we really are. I mean, we talk about local authorities, and my wife, who's about to be a graduating law student, has been saying for years and years that the most powerful people in Washington state are local public health officers. And that's kind of come to fruition. So just remember that we're under the National Emergencies Act, which is broad and powerful for the president, the Stafford Act, which gives FEMA and all of emergency management its authorities, and then the Public Health Services Act, which does the exact same thing for public health. How those three come together and work is really the construct for how we respond in the nation right now, and it's not been very easy.
Thanks, John. I appreciate that really detailed explanation. I think you made it very clear. Thank you. Karen, I'd like to ask you what your view or your impression would be on how scouting might be evolving in a long-term sort of sense with an extended COVID-19 pandemic situation.
So Warren, I want to share with everybody, I am very impressed coming in midway in the COVID-19 shutdown and seeing what had been already implemented at the council level. I was very impressed. We have entered into a really unknown time in scouting, and the innovation has surfaced like I have never seen before. Unit leadership is seeing exactly what they can do, not what they cannot do, and that's what makes it exciting. And it's truly coming from the youth and them saying, we want to scout. And so we just encourage, what can we do as a council to give you the tools to continue on your scouting adventure? I look at this as just something that this too will pass, but we have to have our due diligence to ensure that we mask up, we have it handy dandy here, and that we have the tools in order for us to continue delivering the council operations, but also giving the unit leadership the tools in order for you to carry on your scouting adventure.
Thank you.
I would like to thank you though, Warren, for putting this together.
But I'm gonna say one thing about what Karen said, and I agree with everything she said. But we've had some units that have tried to get very innovative.
Fair.
And so a question that we got a couple months ago was, well, if a unit is chartered by a church and meets at the church, that means the unit is a religious organization. That's not what the public health people are saying. So it's always good to check with those people. And again, the unit was being innovative, but a unit that's chartered by a church and meets at a church is not considered a religious organization and doesn't fall under those guidelines. And again, it's one of the challenges we all have of looking at it and finding out what makes sense for our scouts. But I agree with you, the virtual trips that people are doing, the small, instead of the whole troop going, they're going as a patrol.
We've even seen a virtual parade.
A virtual parade. There's lots of ways that scouting can happen. You can take, as an example, the citizenship merit badge. Well, one of the requirements was go to a city council meeting. Well, most of them are done online now. So that scout, 2 adults and 3 scouts don't have to go on a Tuesday night to a council meeting. They can accomplish the same goal virtually. And I would point out also, and it changes regularly, the advancement requirements are changing and being modified. Not so much changing, but being modified and adjusted for this time. And on Scouting's website, there's a great document on COVID response that specifically talks about some of the changes or amendments or adjustments that have been made to advancement requirements.
And thank you for bringing that up. That's very important, especially when we consider the short window for the new inaugural class of Eagle Scout, the young females in Scouts BSA and young men.
But it's really important as unit leaders that you check those resources from the national office, because the last thing any of us want at this table is to have that young person move up, think they've advanced, and get hung up in some rule that wasn't followed.
Absolutely.
So I guess the basic message is continue to scout. We have to make adaptations. We always have to improvise, adapt, and overcome any situation we're in. And we have the capacity to do it. We have the resources to do it and the support. I'd like to thank the entire panel, Roger, Karen, John, for joining us today. And do you have any parting thoughts before we?
No, I just want to thank everybody. This is a team effort. And so we are learning by actually doing every single day. And it's important that we really zero in on the whole purpose of scouting and following the Scout Oath and Law, just like mentioned earlier today. So I do want to thank Warren for putting together this fireside chat. It's important that you hear from the leadership of the council our position in keeping every scout safe. So,
Thank you very much.
let's mask up, scouts.
Keep our distance and wash our hands.
All right.
Thank
Again.
you.
Yeah, thanks a lot.